Also, the hospital has, well, I'm going to step ahead of myself. I should say that we've incorporated a new company, Northumberland Medical Arts Inc. And Northumberland Medical Arts Inc. is a not-for-profit corporation, and it has leased the land here from the hospital for the next 20 years, and then it will sublet the space to the actual tenants that are occupying the first, second, and third floor. So discussions continue with several of the chartered banks. We've had a number of meetings with each of the primary bankers, and those discussions have been very positive, and we'll be getting down to the what I would call the final application and looking for that final approval in the next 2 months. And you can see to my left here there were a number of drawings that have been prepared. Bill Lett, a local architect, was hired approximately 6 weeks ago and has been very busy with drawings and meeting with the tenants and meeting with the town and making sure that this building will be an enhancement to the town of Cobourg, to the hospital, and it'll provide space for doctors and other related healthcare professionals in close proximity to the hospital, so that it should help with recruitment and retention of doctors, and it should help with encouraging doctors to maintain what are referred to as hospital privileges, so that they look after their patients when they're hospitalized. And in time, it's going to produce a great deal of revenue for the hospital. The payments will be minimal in the early years until the debt is paid off, but when you get out 10 or 15 years, the annual payments to the hospital will be very substantial. So it will have that secondary benefit of raising revenue for the hospital long term. So I think that's, well, I guess we'd be hoping to go to tender in approximately 2 months and hoping to start construction in October. We have a completion date of November 1, 2016, and the building will take approximately a year to build, approximate cost about $10 million. I think that's probably pretty much an overview. I've got Dr. Mark Isak and Michael Parker here who can speak to various different things. If either the gallery or the media have any questions, we're happy to deal with the questions that anybody might have. So you want to come in closer to things in case there are questions, so you can refer to things.
We didn't want to get too close.
No, I think it's I think key part is something for the community to make sure we have family medicine firmly established, so that the constituents or the people of the community have a family physician is one thing, and that the family physicians keep working with the hospital. So those are the major goals. So it's housing not just the physicians, but the whole family health team. So it's getting all the physicians and the allied health professionals, so our dietitian, social worker, pharmacist, everybody all together in one area, so we can actually provide a little more seamless care to our patients at one place.
And it's great to have Lou here. Did you want to join us up here?
I can talk from back here. So I just want to say congratulations for coming this far so fast. And you know, anytime that you get the local community on trying to deliver, in this case, healthcare, and tied in with primary and acute healthcare, it's always a good thing, because it's the folks on the ground that know best. And I look forward to working with the group to the best of my ability to make sure that people, at least in West Northumberland, although there's no imaginary lines, get best health care close to home as they can. So this is fantastic news, so congratulations.
Thank you very much. Well, we found out when we got into detailed planning that the services, the trunk mains coming up in the public streets, would permit a connection over here much easier than hooking into the services for the hospital, and it would have been well over $1 million extra cost from a servicing point of view. Also, from a planning point of view, the town of Cobourg much preferred the building up close to De Palma Drive as opposed to the back of the property. The Northumberland Family Health Team was happy with the new location, so it seemed to suit everybody, and hence we moved the building. To develop any kind of a project, there is a real journey that has to be gone through. I liken it to many intersections. If you were driving, say, from here to Mississauga, you've got a lot of intersections to go through no matter what way you go. And so we've been getting through these intersections, and we've still got some major ones to do, but I think we're over halfway there, and I'm quite confident that we're going to be able to get through the next intersections. The next intersections, of course, are finalizing arrangements with one of the chartered banks for approximately $7 million. Getting the approval of the long-term lease of the lands from the hospital to the Northumberland Medical Arts Not-for-Profit Corporation, and getting the approval of the ministry for the sublease to the Northumberland Family Health Team. So we have site plan with the town of Cobourg as well. I hope it'll be in place before the end of August. Because of the extensive meetings, we don't anticipate any difficulty there, and hopefully we'll clear the two ministry approval processes, and then it's just a matter of making sure we have the money and we can start digging. Well, and the pledges actually came in at more than we were looking for. Initially we were looking for $2 million, and we have pledges for approximately $3 million. So the community responded, the response was just incredible to it, and that was sort of the unique aspect of this project, to go out and look for people that were prepared to put up $25,000 or multiples of it in the local community, and their only security is basically a promissory note, and they have confidence in the project, and you know, we've had accountants looking at the matter and everything, and it all looks good financially. Once the promissory note holders are paid off and the bank mortgage is largely paid down, revenue will generate about $500,000 a year for the hospital, $300,000 to $500,000, because all what we normally think of as profit, all the revenue over expenses is going to go to the hospital. No, because it's entirely separate. The hospital's not legally able to embark on a project like this. Hence, again, the concept of a long-term lease and the new not-for-profit corporation on it. The hospital can't take the risk, because there's always risk involved in any project, even though we think it's minimal as we get through the different processes here. The hospital could not undertake that, so it's entirely separate from the hospital. The only involvement of the hospital is to provide the land and make use of this land, which we've been trying to do basically since the hospital was built, so that there'll be a revenue stream ongoing for the hospital. We don't want to just sell the land, because that would be one quick fix. We wanted a revenue stream, so this will provide a revenue stream basically forever, and you know, it's going to be better. I like grass, but it's going to be better than growing grass and dandelions.
You guys just turn this side up.